Let's talk about the axial view. It's Dr. Collins with the Advanced Orthogonal Institute, more specifically how to set one up. So your axial view, many of you might also know this is an APOM, even though AdvO is going to take it a little bit different, right? You're not taking it on an arbitrary 0 angle. We're actually going to do a C2 George's line to capture the true, but we'll get into this. Axial view, right? You are going to take an axial view in all cases. This is not sort of in this situation for advanced orthogonal, this is going to be one of our 4 core views. All right, so I'm going to dive into this a little bit. With advanced orthogonal, you're going to use this primarily to determine the axial circle, that axial surface circumference on C2, but it's also going to be a secondary reference for determining your AXSP line, which is composed of 2 points on the dens, at the base of the dens, the spinous process tip, and then the lateral margins of your C7 body. So this is a really nice view when done accurately to get that secondary reference, because often on your frontal films, you're going to notice, especially as that angle starts to get increasingly high on your S line, that some of those lower cervical structures can get washed out. An axial view is also going to be a great reference for, like, if you have a broken dens. Hopefully not. So if you'll remember from your sagittal film, right, like you are pulling that S line to take your frontal film, but the second line that you're drawing on there is that George's line off of the body of C2 and AdvO. And the reason we're doing this and not just dropping an arbitrary line at 0, right, is you could have a 10 degree C2 angle, you could have a -10. You want to capture it accurately, and you want to capture it accurately so that you get an accurate axial circle measurement. The axial circle is 1/2 of your C/A measurement, which is going to determine or heavily influence the height that you adjust somebody at. Now, if you were to take that axial circle off of your frontal film, which is very common, this is one real life example here where the disparity between the two is 10 degrees. You got a George's line off of your C2 at 3.47, and you've got a S line, that frontal film angle is going to be on a 14. So that's 10 degrees different. What that's going to show up, if I was to take the axial view and look at the frontal film and have them side by side, is on that frontal film, you're going to end up having a rounder half circle, maybe even a full circle or more disparity between the axial circle that you pull off of your axial view and then the axial circle that you would pull off of your frontal film, which is no bueno when we're talking about adjusting somebody accurately. All right, so lastly, in terms of setup, right, really, you already took a frontal film if you're doing this in the progressive order, sagittal, frontal, axial, horizontal. You just took a frontal film, so you just removed all the rotation. You did the ocular orbit assessment where you're making sure that that person's head is looking at you symmetrically. You took that frontal film, it was perfect. This next view should be pretty easy. What you're doing now is effectively setting the camera up, setting the tube up to match the angle of that George's line. So in our example here, 3.5, right? You're taking it from the 14 degree S line you just took, bringing it more shallow to 3.5, and then you're going to shoot that open mouth. Really, the focus is going to be making sure that the occiput or teeth are not in the way. And so if you have to slightly adjust the patient's positioning, and I'll show you what I mean. I use a string to accomplish that. With that mouth open, I have that string across, right? And I'm making sure with everything lined up with the angle that I need, with that mouth open, the teeth are not going to be blocking, right? You can have, if you need to capture those axial circles, if the head is tilted too far down, it can block, the teeth can block that. And also if you have too much extension in your picture, you can even have the bottom row of teeth and or the skull. You have to make sure everything's out of the way. And so having that string come across, and sometimes I'll even just kind of palpate just below their occiput and make sure that area is open and everything. I have a clear window. That way you don't have to hit them twice with radiation. So take this step, make sure it's perfect. Again, you already took your rotation out, so it should be pretty easy. All right. So that just about wraps up how to take an axial view don't sleep on this one. I know it's kind of a abbreviated, quicker video, but taking a clean axial view, again, is going to heavily impact the height that you set the instrument head up at. So, segue is we got a seminar coming up in November. It's our annual conference, and this is like our homecoming. So, listen, it's going to be packed, CBCT, all kinds of goodness, everything we were talking about today and more. You should be there. But mark your calendars. November 2nd, November 3rd is the annual conference. Other than that, thank you for watching this. I hope you found this valuable and maybe implement some of these little changes in your own practice. Even if you're not doing AdvO, consider it, But hope to see you at a future conference. If you have any questions, leave them in the comments. Shoot us a message. Somebody will be happy to discuss the wonders of AdvO and how it can benefit your patients, get them holding, and save you a lot of headache. So have a great day. God bless.